Let's talk about natural options for migraine. And I mean actually evidence-based options, not just what someone's mom swears by on social media. It's important to know that if a supplement isn't mentioned in this video, the evidence is either weak or it's non-existent. So that includes a supplement like B12, for instance. Now, if you have an actual deficiency in vitamin B12 or any pathology, you absolutely need to correct it because deficiencies disrupt your body's homeostasis and can fuel migraine disease. But we're focusing on what works for prevention and treatment in people without deficiencies. So the general migraine patient population. An important disclaimer: natural does not mean safe. You have to always consult your healthcare provider before starting any supplement, especially if you're on other medications or if you have other conditions. So let's start with nutraceuticals. So what are they? They are nutritional supplements like vitamins and minerals that target specific metabolic pathways involved in migraine. So riboflavin or vitamin B2 has some of the best evidence we have. The recommended dose is 400 milligrams daily, which is higher than what you'd get from food or your just general diet. But that's the dosage based off studies. In a landmark study, 59% of patients got at least 50% reduction in migraine attacks compared to only 15% of placebo. So here's how riboflavin works. It's essential for your mitochondria, which is the powerhouse of the cell. It gets converted into compounds that are critical for energy production. So people with migraine often have impaired brain energy metabolism, and riboflavin helps restore normal cellular function. Now, there's a catch to many of these medications, or nutraceuticals rather, and I will mention them as we go on. In this case, you need 3 full months to see the results. And also, your urine will turn bright yellow to orange, and that's completely harmless as long as the color change is from the riboflavin and not some pathology that it may mask, like increased bilirubin. However, with increased bilirubin, you'll see color changes in other parts of your body as well, even before the urine changes color. So it should be, just know that it does cause a change in urine color, so don't be alarmed. And also just know as well that it can mask an actual pathology if that pathology does cause an increased yellow-orange hue of the urine. So the safety profile of riboflavin is excellent. It has no significant drug interactions. It's safe in pregnancy and in kids. Pediatric studies also showed similar effectiveness to adults. Next is magnesium, and this is where the details really matter. The therapeutic dose is 400 to 600 milligrams daily, and studies show significant reductions in attack frequency at those dosages. Now, magnesium stabilizes neuronal membranes. It also modulates NMDA receptors, and those are the receptors involved in pain signaling, and it also influences neurotransmitter release. Now, here's the issue. Most studies use magnesium oxide. Magnesium oxide has terrible absorption. Only 4% gets into your system. The rest sits in your gut and causes GI disturbances like diarrhea. So while it's the most studied form, basically because it's practical, because it's cheap, and it's widely available, it may not be the best option. However, there are other options, and I'll go through them now, but if you want a more detailed version, please check the article in the description. So we have magnesium glycinate. This has high absorption and excellent GI tolerance. It's chelated, meaning it's bound to an amino acid that helps it absorb better. It may also promote sleep, which is great for migraine patients. Next on the list is magnesium citrate. It offers moderate absorption with fair tolerance. It's a good compromise between effectiveness and cost. Next is magnesium malate, and this might help with energy and fatigue. In fact, some fibromyalgia patients find this form rather helpful. Next is magnesium taurate, and this may benefit cardiovascular health and has a calming effect. Next is magnesium L-threonate, and this crosses the blood-brain barrier, so theoretically it should be very effective, but it's expensive and hasn't been studied specifically for migraine. So if you want to follow the research exactly, use oxide, but expect GI issues. For better real-world tolerance, your best bet might be to start with glycinate. It may also be best to divide your dose. Take 200 milligrams twice daily rather than 400 milligrams at once and take it with food. And also give it 2 to 3 months, just like riboflavin, to work for migraine benefit. Also, use with caution if you have kidney disease and be aware that it can interact with certain antibiotics and blood pressure medications. This is why you shouldn't start anything, even if it's natural, without consulting with your physician. Next on the list, we have coenzyme Q10. Now, it shows strong results in pediatric populations. Unfortunately, the adult studies are mixed, with some showing absolutely no benefit at all. So the dosages range from 100 to 300 milligrams daily, and studies found that kids with low baseline CoQ10 levels and many kids with frequent headaches do have low levels, and they experience significant improvement. Open label studies showed more than 50% reduction in headache frequency in up to 65% of pediatric patients. And again, it's very important, adult studies have variable results. Effect size is much smaller, and this might be due to age-related changes in how adults metabolize CoQ10. CoQ10 absorption varies a lot between people, so taking it with dietary fats may improve absorption. And you also might see products labeled as ubiquinol versus ubiquinone. Ubiquinol is the reduced form and may have better bioavailability, though most migraine research does use ubiquinone. And safety is excellent across all age groups with CoQ10. It has minimal side effects, so that's great. But if you're on warfarin, monitor your INR, or your physician should monitor your INR, since CoQ10 has mild anticoagulant effects. So again, it's very important. Natural doesn't always mean safe. Always take any supplement under the guidance of your physician. So next we have alpha lipoic acid. 600 milligrams daily showed moderate effectiveness in studies, and the main trial showed significant reduction in attack frequency, migraine days, and severity compared to placebo. However, the 50% responder rate wasn't significantly different from placebo, which tells us it helps, but maybe not dramatically. ALA, alpha lipoic acid, also works as a cofactor in the Krebs cycle, or TCA cycle, or citric acid cycle, whatever you want to call it, and that's the energy production cycle in your cells. It's also a universal antioxidant that can generate vitamin C and E and glutathione. So here's the interesting part. ALA may be most effective in patients with insulin resistance or metabolic syndrome. One study showed it reduced serum lactate levels and markers of vascular inflammation, suggesting benefits beyond just migraine reduction. Now, in regards to safety, ALA can enhance insulin sensitivity. So if you're diabetic and taking insulin or other glucose-lowering medications, monitor your blood glucose closely and avoid it if you have a thiamine deficiency as well. Now, the long-term studies aren't yet available on ALA, so keep that in mind as well. Now we have vitamin D3. 4,000 IUs daily works primarily if you're deficient. So that's important because the evidence for taking vitamin D if you're not deficient is lacking. However, vitamin D deficiency is significantly more common in people with migraine compared to just the general population. Now, the pediatric data is actually impressive. One study showed 76% of children achieved greater than 50% headache reduction when D3 was combined with topiramate versus only 36% with topiramate alone. Now, again, this is in kids. In adults, studies show benefits mainly in those who are deficient, not those who present with no deficiency. You might just be wasting money if you take vitamin D and you're not deficient. What should you do then? Should you take vitamin D? Well, check your baseline 25-hydroxy vitamin D levels before starting treatment, and then go from there under the guidance of your neurologist. So you can find out your vitamin D levels, and that's what you should do. Now, it's important to note that studies show that higher dosages, 4,000 IUs, work better than lower dosages like 2,000 IUs. And your doctor should also monitor serum calcium if you're on high dose therapy. And it's contraindicated if you have hypercalcemia or sarcoidosis, and it can interact with thiazide diuretics and digoxin. So again, natural does not mean safe. Keep that in mind. It's important. So next on the list, we have omega-3 fatty acids. Now, these have mixed evidence. Network meta-analysis of 5 trials showed inconsistent results, 3 negative studies, 2 positive. Here's the pattern. Effective studies used high doses. So EPA 1.8 grams plus DHA 1.2 grams daily. Studies with lower total omega-3 content, so about less than 1 gram daily, generally showed no benefit at all. One high-quality randomized control trial with 70 patients found reduced migraine days with the high-dose combination. Now again, same as with riboflavin, same as with magnesium, you want 3 months in order to determine efficacy. And safety with omega-3s is excellent, though it may cause myalgia, eye upset, or a fishy aftertaste. And You should be aware that omega-3s do have antiplatelet effects. So again, speak to your physician before trying anything, even if you think it's fine because it's over the counter. All right, so next we have L-carnitine. L-carnitine doesn't work as monotherapy. That's important to know. Taking it alone, you're wasting your money. It's not beneficial. Randomized control trials showed no significant benefit when used alone. However, one study showed positive effects when L-carnitine, 3 grams, was combined with CoQ10, and it was 30 milligrams for that daily. So this combination reduced headache severity, frequency, and duration. Consider L-carnitine only if you have a documented deficiency, or you're already taking Q10 and you want to just try the combination. It's generally well tolerated, but may cause GI upset or a fishy body odor in some people. So we're done with the nutraceuticals. Now let's get into the herbal products. So what are herbal products? Well, these are plant-based medicines. They have traditional use histories that now have modern clinical research supporting them. And we'll start with the famous ginger. Now, studies have used varying doses, but a minimum of 250 milligrams is generally needed to show effectiveness. Now, the research quality on ginger is mixed, but here's what we know. It contains compounds that inhibit prostaglandin E2 synthesis. Those are inflammatory chemicals. It also has anti-inflammatory effects through 5-lipoxygenase inhibition, and it also modulates serotonin receptors. There's also evidence it may also affect CGRP pathways, which are central to migraine pathophysiology. Studies show ginger help with nausea, very common, many people know this, and that often comes with migraine attacks, so it can be particularly useful in these cases. You want to take it at the first sign of an attack, and you don't want to go to the supermarket and just buy fresh ginger. That's not going to give you the amount that you want. You want to get ginger powder for consistent dosing. You want to know how much ginger or how much ginger extract you're actually taking. So it typically starts working within 30 minutes, and you can repeat it after 2 hours if needed. It's not effective for prevention based on the current evidence. However, the safety profile is excellent and even safe in pregnancy at food level dosages. Again, please speak to your physician before use, even for ginger, because ginger has anticoagulant effects. Everything I mentioned is to be done under medical supervision. Next, we have topical menthol. Now, menthol provides rapid relief. A study used a menthol solution applied to the temples and forehead in a randomized double-blind placebo-controlled crossover design study. Now, 50% of patients achieved meaningful pain reduction within 15 minutes. Menthol has more than one mechanism of action, but the more well-known one is its activation of TRPM8 receptors, and these are the cold sensing receptors. And now menthol provides an analgesic effect through what we call counter-irritant mechanisms. So apply to the temples, the forehead, and neck using gentle circular motions, and its effect usually lasts 2 to 4 hours, and you can reapply as needed. And it's also generally safe for topical use, but it may cause skin irritation in sensitive individuals. So you want to always test on a small area first and avoid contact with the eyes and the mucous membranes. So next we have capsaicin. Now this is the compound that makes peppers hot, and it works topically at concentrations of 0.025 to 0.075%, generally as a cream. Now, studies show that can provide significant pain relief when applied to temporal arteries, occipital arteries, and even intranasally. However, intranasal application should only be done in a professional setting. Do not do this yourself. One study found 80% of subjects reported substantial headache pain relief within seconds of application, and it lasted several hours. It works as a TRPV1 agonist, causing initial activation followed by desensitization of pain receptors. So it hurts, stops hurting. So apply small amounts to temples and back of the neck, and don't forget to wash hands after the application, and also avoid eye contact, please. And start with lower concentrations like 0.025%. Again, it hurts at first, so expect initial burning sensation. And I have to say this again, do not attempt intranasal application yourself. It causes intense pain and should only be done by trained professionals. Next, we have lavender. Now, this is an essential oil. It can work through inhalation, and it showed effectiveness in a placebo-controlled trial with 47 adults. So not a huge sample size, but still worth mentioning. Participants inhaled lavender for 15 minutes and reported notable improvement in headache severity, nausea, vomiting, and photophobia, that's light sensitivity, and phonophobia, that's sound sensitivity. Now, some people opt to place 2 to 3 drops of this essential oil on the upper lip and inhale deeply. Some people use an aromatherapy diffuser. Some use it as a topical application, but with dilution with a carrier oil. And some benefit from inhaling directly from the bottle for around 10 to 15 minutes. It has a good safety record for aromatherapy, but it can cause skin irritation if applied undiluted or, again, in sensitive individuals. So keep that in mind. Next, we have curcumin. Now, curcumin is extracted from turmeric, and effectiveness is shown at 500 milligrams twice daily. It showed benefits in a double-blind randomized trial, so this was over 8 weeks, and it significantly reduced migraine attack duration and severity compared to placebo. Also, serum CGRP levels, that's the calcitonin-related peptide we mentioned earlier. It's a neuroinflammatory peptide in migraine, was actually decreased with curcumin treatment. So again, over-the-counter spices don't work. You would have to get a curcumin extract. Curcumin has poor bioavailability when taken alone, so combining it with piperine, that's black pepper extract, improves absorption. Also, you want to look for standardized extracts. Again, not just spices, not turmeric. You want curcumin. You want 95% curcuminoids in the curcumin. Curcumin is generally well tolerated with minimal side effects. However, it may enhance effects of anticoagulant medication, so that's something to keep in mind. Also, you want to avoid it if you have gallstones or bile duct obstruction. Next, we have cinnamon. You can't just use any cinnamon though, Ceylon cinnamon. So 600 milligrams daily showed effectiveness in a double-blind trial. It significantly reduced attack frequency, duration, and severity compared to placebo. Blood work showed reduced inflammatory markers, including serum interleukin-6 levels, and it works similar to how ginger works, providing anti-inflammatory effects, and it also may modulate pain pathways. Again, use Ceylon cinnamon. Ceylon cinnamon has an excellent safety record for extended use. Other types of cinnamon may be problematic for long-term use, and also you would have to give it 2 to 3 months to see the results. Next, we have feverfew. Now, this has mixed and disappointing evidence. Multiple controlled trials show inconsistent results, but I believe this is because product standardization varies dramatically. Dosages matter, and you'll find feverfew supplements with the important compound we care about in feverfew. It's called parthenolide, ranging from 0.1% to 0.7%, which makes it hard to know what you're actually getting. Now, the studies using the standardized extracts found significant reduction in attack frequency, up to 62% in combination studies. But isolated feverfew studies remain inconsistent. Recent research suggests it might work better in combinations. One study used feverfew 100 milligrams with CoQ10 100 milligrams and magnesium 112.5 milligrams. 75% of patients achieved at least 50% reduction in headache days. So if you decide to try feverfew, ensure products are standardized to parthenolide content and consider using it as part of a combination approach rather than alone. Next, we have butterbur. Now, butterbur deserves special attention because it has excellent efficacy data, but serious safety concerns. The studies were impressive. Studies found butterbur extract reduced migraine frequency up to 48% versus placebo, and multiple high-quality trials demonstrated effectiveness for butterbur. It worked so well that it was actually considered a first-line preventive treatment. But here's the problem with butterbur. Post-marketing surveillance revealed that it causes severe hepatotoxicity, that's liver damage, and multiple cases of liver failure actually required transplantation. So this is even true with PA-free products. Now, major headache societies no longer recommend using butterbur. The risk-benefit ratio is not favorable. However, with that said, it still has strong efficacy. It has strong evidence. Still, most don't recommend it. So that's everything with legitimate evidence. Of course, there are natural compounds like cannabinoids, psilocybin, melatonin, etc. But melatonin is a hormone and it deserves its own video, and cannabinoids and psilocybin are pharmacologically active compounds. So let me give you a framework for actually using this information. First, consult your healthcare provider. Now, just because something is natural doesn't mean it can't interact with your medications or interfere with health conditions that you may have or health conditions you may not know you have. So it's important to always refer to your physician. Everything has to be under the guidance of your physician. Second, start with one supplement at a time. If you start 3 things simultaneously and feel better, you won't know which one helped. And it's also a good way to save money. If something doesn't help, you don't have to keep purchasing it. Third, keep a migraine diary. Track attack frequency, severity, duration, and associated symptoms. This is the only way to objectively assess whether something is working. Fourth, be patient. Most preventive treatments take 2 to 3 months to show full effects. If someone tells you their supplement worked in 2 weeks, that's likely a placebo effect or just a coincidence. For acute treatments like ginger, menthol, capsaicin, or lavender, you should see effects within minutes to hours. For preventive treatments like riboflavin, riboflavin, magnesium, CoQ10, curcumin, or cinnamon, you might need to commit to at least 8 to 12 weeks. Now, combination strategies can be effective because different supplements work through different mechanisms. Riboflavin plus magnesium targets both mitochondrial function and neuronal excitability. CoQ10 plus riboflavin enhances electron transport chain function at multiple points. Vitamin D3 plus magnesium provides complementary anti-inflammatory mechanisms. So for acute treatment, ginger plus topical menthol gives you a dual pathway approach. Special populations may also need extra consideration. Those who are pregnant, those who are breastfeeding, children. This is all something to keep in mind. So I hope that we can see that natural approaches have a legitimate place in migraine management. The evidence for riboflavin, magnesium, ginger, they're strong. CoQ10, we know, works well in kids. The other options have varying levels of support, but they may be worth trying as part of a comprehensive approach. Now, these supplements work best when combined with lifestyle modifications, stress management, adequate sleep, regular meals, and, of course, appropriate medical care. The goal isn't to replace conventional treatment, it's to find the safest and most effective combination for your specific situation. Lastly, remember that just because we have studies on these supplements doesn't mean they'll work for you or they'll work for everyone. Migraine is complex, and what helps one person may not help another, and that's why the diary is so important. It lets you make data-driven decisions based on your own care. Okay, that's all I have for you today. Thank you for watching, and don't forget to subscribe.